Just to give some insight about myself, I'm a practicing internal medicine doc for well over 18 years now, between practicing in Ohio and then here in the Houston North Woodlands, Conroe area. So I really got, involved in learning about alternative medicine, which included modalities, including CBD, and really learned how we all have the endocannabinoid system and how it brings us back into a balance, which our body's always trying to do. Be it if you're in a stressful situation, it's always trying to rebalance. If you fractured something, it's always trying to heal. And the endocannabinoid system actually is a communication system between all your other systems. More and more research is coming about regarding it. It's still in its infancy and really has been just studied since the 1990s. There's more data, obviously, in Europe and Israel, and I think the U.S. is finally starting to do its own studies ever since the Farm Bill passed in late 2018. But that being said, I'm going to briefly talk about DNA technology, which can be beneficial in dosing. And what typically occurs in this industry, not only from an alternative medicine standpoint, but in prescription-based meds, usually is a trial and error on dosing. I may start someone on a blood pressure medicine and, one patient may require 10 milligrams of it, while another may require 40 milligrams of it, even if they're making the lifestyle changes and everything else involved. But, a partnership that we presently got involved with, and I met Greenway DNA through my travels throughout the U.S. as I was still learning the intricacies of CBD and how it functions. Most individuals go through a trial and error methodology of finding the right dose of CBD, and that probably is about 50% of individuals. And it'll take them 3 to 6 months and several hundreds and thousands of dollars they've spent in this time frame and really haven't found the true solution on what is the right dose. So this patent pending data, which is personalized to each individual, it's really user-friendly, it's accurate, and it's validated, has been instrumental in helping not only myself, but my mom, who really suffers from Parkinson's and was looking for the right dosing for the CBD. Actually put her through the test. She sent it off and it came back showing the accurate dosing that's required. And what makes this unique is it's direct to consumer. It's very personalized report. It's really specific to your own DNA genetic makeup, which is unique. Each individual, if you think about it, has these proteins that are encoded by DNA that process and metabolize CBD. So these SNPs, or what we call single nucleotide polymorphisms, give the uniqueness to all of us. Barry may have a sequence that's AGT, and I may have a sequence that's GTA, and that will uniquely give us better dosing accuracy, because Barry may only need 10 milligrams, while I may need 20 milligrams, even though people think that, the higher dose amount you take, the more higher dose effect you're going to get, which is not really true based on our genetic makeup. So this test has actually been very, very significant, because we have over 3 million of these SNPs throughout our body. And by taking the test, it gives us an accurate dosing component, which allows us to accurately say, hey, here are the side effects of the drugs, here's the possible effects of the drugs, and the doses required of those drugs. So it's easy, it's very user-friendly, and it basically comes in the mail. You basically put some saliva and send it off, and you get the results back pretty quickly and accurately. So I myself have taken the test, my mom has taken the test, and it's done wonders on improving the accuracy component without having to play this guessing game. So I encourage everyone to read about it, do the test. It's a one-time test, and that actually not only gives you a CBD breakdown, but a THC breakdown, because I think in the future, as more and more states deregulate, I think ultimately the nation will deregulate. And at that time, you'll see more full spectrum and broad spectrum where you're going to have combinations of CBD with THC, which is going to give you a synergistic dose effect, which is lacking. So that's the first thing I wanted to kind of discuss was the DNA technology. The second game changer that kind of puts wellness on the mark compared to anyone else out there that's doing CBD is what we presently call is our CBD meter dose inhaler. And it's an FDA approved device that, currently passes GMP certification and good manufacturing practices. So most of us, when we take a medicine, we're relying on our gastric system and our first pass through our liver on what really gets absorbed. So we lose some of the potency of that medication. So even though it says 100 milligrams or 50 milligrams, we may only be absorbing and getting 70% bioavailability or even lower. So the only thing that's been proven that gives you 100% bioavailability is IV. And the second most proven methodology is through your respiratory tract. If you can get an aerosolized medication down to your alveoli where gas exchange occurs, your bioavailability is close to 100%. It's 98%. You may lose a few percentages, but that is the second most potent way of getting a dose effect. And by having this unique meter dose inhaler on our repertoire just is a game changer because your ability to provide relief is instantaneous. So it's the most cost-effective dose methodology that we have. It's high-quality CBD pure isolate, and it's safe and accurate dosing. So unlike some of the products out there where it's a tincture or an oil where I have to take a pipette and dose and see if I get the appropriate dosing, this per dose gives you safe, accurate dosing, which with no messy measuring, which is a game changer if you ask me, and it's fast acting. So because it gets into your blood system pretty instantaneously and the bioavailability is close to 100%, you see an instant relief and an instant component of symptom management. So again, it doesn't change any of our other products, but it gives a different methodology of giving the product which more people are looking for. And I've used it. I've had several of my patients use it, and they come back saying they're amazed on the quickness of the product. So those are the two things I wanted to briefly talk about today. If you guys have any further questions, I'm glad to answer them. And then I know there's more information about our meter dose inhaler as well as our DNA technology on our website.